The information shared on the Allo podcast is not intended as medical advice. Your medical care decisions should be made in consultation with your physician who is familiar with your specific case.
Hi, welcome to the Allo podcast from the Allo Hope Foundation. I'm Molly Sherwood.
And I'm Bethany Weathersby. And excuse me. Oh my gosh.
Uh-oh.
Wow.
Ooh.
I don't know what's happening.
Wow.
Yeah.
Not your best podcasting voice.
Yeah, it's been a while, actually. Wow. Oh
yes,
my gosh.
It has.
Yes. It's been actually, we took a little break because we were traveling and all of our many children were just home surrounding us. And so
very
all the
much
time,
so.
they were just
and touching us
all the time. Yeah. They're there, they're touching us, they're needing everything. They only need something when I sit down. Do your kids do that? I sit down.
Oh, 100%.
For any purpose.
Yeah.
And then they're like, hey, Mom, I need blank. Anyway, that's what they were doing all summer. And now we're back. So excuse the rustiness here. But it's so exciting to be together again virtually.
I know.
Yeah.
It's good.
I know. Okay, well, what's our topic today? We're very excited about it, even though we're very nervous.
Yeah.
I think.
I know. We're really not. Are we mentally healthy enough to be doing this episode? I'm really not sure.
Well, that's the topic. The topic is mental health and coping strategies during your alloimmunized pregnancy and then after birth as well. And after birth, I should always just say after delivery. After birth makes me feel a little queasy. Anyway, okay. So after delivery, how to cope with all of the feelings of anxiety and what to do with this trauma that you went through. And Molly and I have been laughing because we're putting all of this information out there with coping strategies, and we are like not the people to be relate.
We were joking about how I woke up with heart palpitations from my anxiety this morning.
I'm sweating. I couldn't sleep last night because I was like, what if I don't do well in the podcast? I don't know how prepared I am. And so it's but here we are. We're going to guide everyone through.
Yeah,
these great
here we are. Just
coping strategies.
Leading everyone.
Oh my gosh. It's going to be great.
With our perfection and wisdom. Sure.
Yes. Okay. We're just real people. And
that's right.
Yeah. Okay. Tell me, this is random, but tell me what your kids have been watching lately, because I feel like what they watch becomes our soundtrack at 2 a.m. in our minds that we can't get rid of.
100%. Well, yeah. I've been pushing Bluey real hard because that's what I would like to watch.
Same.
I love me some Bluey, except it makes me cry half the time, but I just love it. I love the feels I get.
Yeah. Josh cries during Bluey episodes.
Oh, yes, 100%.
Yeah.
But then also my kids are super into, they don't really watch screens during the week. And so now they're all into music. So Spotify is on our TV all the time. But they're transitioning into NSYNC and Backstreet Boys. And I'm cool.
Oh, wow.
I'm here for this.
Oh,
so
you know what?
It's actually
You're
nice.
the one that you set them on that path, didn't you?
I think I probably did. And
yeah,
I think I'm sure I played it once or twice and started it, but then something even more wonderful happened, which is my oldest, Ronan, started playing Little John. Do you know that banger that's called Turn Down for What?
Yes, I love it. Yeah.
We've been listening to that on the way to school, tearing up the country roads, listening to Little John at 7:30 in the morning. Anyway.
Yeah. I love that. And actually,
that's my soundtrack.
When Ronan was riding with me, when we did the blood drive this summer and he was in my van, he did ask for, I think it was a Backstreet Boys song. And I was like, what? Okay. It was just very random. Then he had some Imagine Dragons and just a very, Then Nora was like, can I listen to Tom Petty? My kids are really, they're into Tom Petty. And then, they're into Weezer too.
Oh my gosh. Okay.
And then
I'm into it.
Callum is obsessed with Taylor Swift, just this 6-year-old boy who is, what are they called? Swiftie. It's
the
extreme.
Swiftie. He's a Swiftie. Wow.
Apparently, I guess. Anyway, okay. So this is what August, my 3-year-old, is obsessed with currently. It's Moana. And we watch it over and over and over again. I do too. And I love the soundtrack. But there's this one scene at the end that makes me like weep every single time I see it. And I can't not react emotionally to it. And I thought it was kind of a good segue into this conversation today. And it's, okay, spoiler alert. If you haven't seen Moana, you might want to like
fast forward. Yeah.
Fast forward a minute or so, because I'm about to spoil it. But you guys have had plenty of time to watch Moana.
Oh, yeah. That's, okay. I mean, that's like 6 or 7 years old, right? Yeah.
Yeah. I mean, who knows? I lose all track of time in my life. But okay, so at the end, Moana realizes that, well, there's the lava monster, and that's what August calls it, the lava monster. And that's the like most terrifying villain kind of throughout the whole movie. Okay. And Moana realizes that the lava monster is actually Te Fiti, which is like their goddess of love and prosperity. And, at the beginning of the movie, it shows Maui ripping out Te Fiti's heart and taking it. Okay, so then without her heart, she has no life, no love, and she's trying to desperately get her heart back. So Moana realizes suddenly in this like battle scene that the lava monster is Te Fiti. And so Moana walks right up to her and she's singing this song. I actually looked up the lyrics, and the title of the song is Te Fiti Restored, which I love so much. And so it's just very fitting. And Moana sings in the song, she says, "I've crossed the horizon to find you. I know your name. They may have stolen the heart from inside you, but this does not define you. This is not who you are. You know who you are." And then she gives the heart back to Te Fiti. And then Te Fiti, I have goosebumps. She's just filled with like life again and like love. And then she's not scary. She doesn't look like the lava monster. And then things all around are growing and flourishing. And it's like so beautiful. And so, yeah, I just relate so deeply to that.
I know. I know exactly the scene you're talking about, and I can like sing the song in my head. But it's so beautiful. Yeah. She's just like transformed in these flowers, and greens are growing around her. And she had been like raging in the ocean, and then she just lays down and creates this like beautiful little like soft mountain range. And it's so awesome. Yeah.
And everything is flourishing. And so I relate to that so deeply, because I feel like this disease like literally stole my daughter from inside me and stole other things as well. But it did feel like, I mean, a mother losing a child, it feels like you're losing your heart. It feels like someone has ripped your heart out and taken it. And then you're just left with just trying to survive and longing to have your heart back, you know? And so, when, so I relate to Te Fiti when she's the lava monster, because I remember feeling that way, and occasionally it like pops back up. And then I really relate to her when she comes back to life and starts loving and living and growing beautiful things again. And so I think just kind of having that in mind throughout this podcast episode might be kind of helpful. Maybe not. I don't know if anyone will relate to my cartoon.
That. No, I love that so much, and had not thought of that connection until you said it. Now I won't unconnect those dots now when I watch it. I watch it all the time. That is perfect. That's like the perfect tee up to today's conversation, which we have had a trauma and grief episode in the past. In this episode, even though it's awesome, because our listeners, if they listen to they listen to every episode, which is awesome. I love it. And even still, they were asking, like, I still want to talk about coping through a pregnancy and after with those additional feelings of anxiety and PTSD and the things that linger afterwards. So that's what we're going to be talking about today. And this is a life-changing diagnosis in a lot of ways. regardless of where your disease lies on the spectrum. And it's especially difficult because many women end up having to choose to either stop growing their families or face another really traumatic high-risk pregnancy. And, you know, we've said this a million times before. This is a rare disease. The mental burden is huge. And so we're going to talk through some more tips and hopefully just share some relatable information about what happens often to us and other moms going through this. And then we also have a cool segment for fun because we've also talked in the past. I know we talked about this in the delivery episode, actually, which was the end of season 1, about how preparedness can bring a sense of calm and control when you otherwise don't have it. And so we have a segment where we asked a bunch of moms in our community what they brought in their hospital bag to different things, like to their IUT, to their NICU visit, and all those things. So we have a segment in the end for that. So I'm excited for that too.
Yes. Okay. That's exciting. And then, yeah, I totally agree that it can be an incredibly traumatic experience, especially for those of us who really, really want to grow our families, even after being diagnosed with alloimmunization. And it is very traumatic to have to face that same disease again if you want to grow your family or have another baby. And so it's not a surprise that we do see a lot of other moms, and, you know, some of us have experienced it ourselves, suffering from anxiety, depression, PTSD, and just stress during their allo pregnancies. And before we dive in, I think you just mentioned this, but I wanted to point out again that the trauma and grief episode in season 2, it's episode 8, and it's called Processing Grief and Trauma in Alloimmunized Pregnancies. It sounds like a very heavy episode, and maybe some parts of it are, but actually it's one of my favorite episodes that we've ever done, and probably the one that I've gone back to the most to re-listen to, because it actually encourages me. So I actually love that episode. If you haven't listened, go back and listen to it.
I love it so much. And I remember when we were recording it thinking that I just wish that everybody I knew listened to that episode. And it's not just, I think sometimes people think that trauma and grief are reserved for a very specific experience, like specifically if you've experienced loss. But that's not just who that episode was for. And it's also for people who want to support those people. So I love that episode so much. Okay, so today we'll focus some more on anxiety and PTSD during your alloimmunized pregnancy and afterwards. And we got lots of patient input on this one. So thank you for everybody who contributed to that. And I'm going to start by, I think we've teased this a little bit before, but just defining how wide-reaching this issue is. You know, we've done our own survey studies in women in our support group, and we published and presented a poster at the Society for Maternal Fetal Medicine earlier this year. My gosh, I feel like we've lived like 10,000 lifetimes since
know.
then.
Wow.
I know. With Dr. We did it with Dr. Markham, love her, as we all know. And we asked 127 moms with our condition, alloimmunized moms, whether or not they experienced new or worsening feelings of anxiety, guilt, self-doubt, isolation, depression. And listen to these percentages. It's bonkers. So 91% anxiety, 75% repeated new or worsening feelings of guilt, 68% self-doubt, 71% reported feelings of isolation, 68% reported feelings of depression, and symptoms of PTSD in 61%. That is like off the charts high, but also not surprising, like we've talked about, you know?
Yeah. Wow. I'm shocked every time I hear those stats. I know them, but it's just, that gives a really good picture of what these women are going through. We are going through. So, okay, so let's turn our attention to how to manage this. Maybe we should do this in 2 parts. Should we do during pregnancy and then after pregnancy? Just to keep
love
it
that.
separated.
That's a good idea. Yeah, so let's start with during pregnancy, because there's so many kind of mental, emotional stressors that can pop up during an alloimmunized pregnancy.
Yeah. Okay. What about, how about you and I just start sharing some of the things that we experience. And if the listeners want to hear our whole stories, they can go back to season 1 and listen to our episodes. They're fantastic and very thorough. But so we won't go into great detail, but just maybe sharing some of the things that we struggled with during our pregnancies.
Yeah, I was thinking back to mine, and I remember this sensation that my mind was racing all the time, just like completely inundated with thoughts. But I also had a hard time actually completing my thoughts, like seeing something through to completion, because I was just so overwhelmed with everything that was just clouding my brain. And I spent all my free time reading about our condition because I thought I would feel safer if I had as much knowledge as possible. So I was just like really all in on that. And it was hard to focus on other things during that time, you know?
Right.
And I also remember, like, I don't know if this happens to you when you're feeling anxious. I remember trying so hard to get a full inhale, exhale. And I just feel like I could not, the entire pregnancy, I could not
terrible.
just like, it's like this tightness in your chest, you know, that's what anxiety feels like to me.
Yeah. And that feeling alone will then cause anxiety. Because if you feel like you can't breathe, that's terrifying. Oh, that's a bad feeling. Yeah. I remember I feel that often, and I feel it in my stomach, like clenching my stomach.
Yeah.
Oh man. Yeah. I really struggled with anxiety in my first sensitized pregnancy. Just the extreme and growing stress as the pregnancy went on of like having to understand this complex disease and then realizing I have to advocate for the right care. Well, I don't even know what that is yet. And like trying to learn it quickly, read everything on it, and just deal with this sudden out of nowhere idea that my child's life was threatened. That was an all new thing for me. So, and then of course, during your pregnancy, you are dealing with these hormones flooding in and all kinds of other things. I mean, just pregnancy alone can cause anxiety for some women. And so it's just, I really struggled with anxiety in the first sensitized pregnancy. And I think I've shared this in the past. I can't remember if I did, but this is what it felt like. And again, sorry about the mind pictures. I always go there, but, it felt like there was this picture of like a train track and my baby is on the track and I'm standing watching, but there's a like indestructible fence between me and the train track. And it's like, oh, what is it called? What is that metal fence? Oh my gosh. What is the word?
Like a chain link fence?
Thank you. Chain link fence. So I can like see everything that's happening, but I can't get through. I can't physically protect my baby. And so that's what it felt like. And this like emergency all the time. And then I hear in the distance, like a train coming. It's coming. I hear it. And I can hear it like getting closer and closer. And I'm like, what am I going to do? Just panicking. And then there's this team of MFMs who are on the other side of the chain link fence, and they can save the baby, but they're not concerned. You know, they're not worried. And I'm like begging them. I think that I hear a train in the distance and they're like, don't worry. Anxiety is normal. You know, during pregnancy, you're just kind of an anxious mother. Everything's fine. It's your first sensitized pregnancy. And so dismissing the concerns while the train is getting ever closer. And that is the feeling of that first sensitized pregnancy. And I never could convince the doctors to take the threat seriously. And so it just felt like, my baby's lying on the tracks, and the MFMs didn't really notice the threat until the train actually hit her.
Oh my God. That is that is such an intense visual. And I really appreciate I don't know if it's like an analogy, but I think it's really helpful to help people connect and empathize with what you're saying. It's just very vivid and it's easy to understand.
Yeah.
I mean, it completely makes sense.
Right. And then, you know, to think about another pregnancy, it's like, okay, I now try again. But then in order to do that, you would have to basically, you're putting another baby on the tracks. You're standing on the other side of the chain link fence. You know what you're going into. And so imagine being in that situation again. And then that's where the PTSD comes in, where you think you hear a train whistle or like there's a train on another track and you hear it. And then you just panic and you have all of these physical reactions. And so then, yeah, that's kind of the picture that I get of like, I'm having to do this again if I want to have another baby. Thankfully, I had fantastic MFMs on the other side of the fence who totally handled it. And my babies are totally safe today. But that's just what it felt like for me.
And I think that was really interesting that you said, like, sometimes there's another train or there's a different thing, because that ties into, I think, the way this affects women long term is like, I now have this kind of trained response because I've learned that sometimes I'm the only one who can fight. I'm the only one who can do something.
Yes.
And then that carries over to like, oh, you know, my husband has a bad headache. What does this mean? Like, do I need to do something? And the train, then there's lots of tracks because you think, is this the same situation here? And same with like raising your young children. Like, is my kid's fever going to be okay? Are they going to make it through the night? You know, all these questions, because that cycle, that pathway, like kind of sparks back up really quickly when you've already experienced and kind of proven that, oh, I do have reasons sometimes to be scared or to feel validated in this fear. And then it just can sometimes replicate in other areas of your life even when this is over.
Yeah, exactly.
Ooh.
Yeah.
Yeah. Well, okay. Pretty intense.
Sorry. Well, let me just say, but then it could be something as simple as like you're home playing with your kid and he has like a train puzzle that makes a sound like a train. And then you're suddenly panicking for absolutely no reason. And you're like, why am I feeling like this? You know, everything's fine. I know everyone's safe, but it's just the sound that can trigger all of those feelings again.
Yeah, definitely.
Yeah.
Whew, okay, we have pretty intense mind and sound pictures going on this episode. Train situation, train sounds, lava monsters. Yeah. But this is how intense these pregnancies can feel, and then the ripple effect afterwards. Even if your baby is safe in the end, it's scary to know that they could be in danger, and you're blocked by your chain link fence, you know, visual that you are talking about. So, and you can't directly intervene to protect them like you want to.
Yeah. So, okay, what do we do then? If we're having all these intense feelings, how do we cope? So let's start with how to cope during pregnancy. Okay, so anxiety is actually a pretty normal feeling during pregnancy, and it can be especially prevalent for women who have high-risk pregnancies. And really quickly, I just want to read the definition of anxiety from ACOG, the American College of, American College of Gynecologists.
Obstetrics and gynecology, I think. Yeah. Anyway,
ACOG. Okay. Here's the definition. Anxiety is a feeling of nervousness, worry, or concern. These feelings are normal and common. And anxiety disorder is a mental health condition that happens when anxiety gets in the way of daily life. And it's more than a temporary fear. The anxiety is intense, or it lasts a long time, or both. So that's the basic definition. And like I just said, having a high-risk pregnancy or having a previous loss or a previous health challenge during pregnancy makes you far more likely to experience an anxiety disorder during or after pregnancy.
And I'll read the quick definition for PTSD, which is post-traumatic stress disorder. It's diagnosed when an individual has persistent symptoms related to a traumatic event, including re-experiencing the event, for example, like in flashbacks or nightmares, avoiding feelings, people, or places associated with the traumatic event, having hyperarousal or a high general level of anxiety that can result in symptoms such as insomnia, startling easily, or irritability and outbursts of anger. And don't forget, we cover this in great detail in the season 2 episode we mentioned earlier, so we won't go into too much detail here.
Yeah. Okay. That was a good, see, that was a good explanation. And that's what I was talking about with Tafiti, that like startling easily, being irritable, or these weird like outbursts of anger that are not your normal, personality. That's kind of when I feel like that lava monster is coming up, but it's not because I'm actually angry. It's because my heart was stolen from inside me, you know?
Yeah.
And so it's that reaction to that. So certain things can trigger that response, right? And sometimes these triggers are internal and sometimes they are external. And the trigger can bring this, it can trigger a flashback that reminds you of a past trauma, and then your body responds by replicating the emotions that you felt during the trauma, which is a terrible feeling. And this can cause you to feel things like fear, shame, sadness, abandonment, feeling unsafe, or like the worst thing is about to happen. And then physical reactions too. You can have a racing heart, like you were just talking about. That's this feeling of like, I can't breathe, or like clenching your stomach, or a feeling of even detachment from your body, kind of.
Yeah.
So, that's what
like a dissociation
triggers.
Of like, I have to remove. Yeah, totally.
Yeah.
And there's like internal versus external triggers. So some examples of, internal triggers would be anxiety, stress, helplessness, loneliness, hunger, frustration, physical pain.
Yeah. Yeah. And, okay, so external triggers, especially like during an alloimmunized pregnancy, might be the smell of the hospital when you walk in, or just being in an ultrasound room, hearing the cry of a baby. Katie said the other day during one of our meetings that seeing the blue lights from phototherapy, even in a photo or video, can sometimes be this emotional trigger for her, because she is so traumatized by the time that her son Liam spent in the NICU. So I was wondering, Molly, what are some triggers? Were there triggers, first of all, during your pregnancies that kind of evoked this reaction from you?
Yes, but they continue now. Like they're not over,
right. Yeah.
Like one for me, ultrasounds, period. Because so many of my ultrasounds were being done to see if the baby was still alive. Like that was why they were being done. And so that's what I associate that feeling with every ultrasound, or even like hearing of my friends getting ultrasounds for good reasons, just normal checkups. Just that's how I feel about ultrasounds. Sitting in the waiting room at the high risk clinic.
Yeah.
I get that clenched feeling. The bathroom, that's when, I think I've talked about this before, but I just had so many bleeding episodes that when I'm pregnant, going into the bathroom, I mean, I would avoid it. I would literally try not to go to the bathroom all day if I could.
No way.
Yeah.
That's, oh my gosh. That is, that's really hard to do when you're pregnant.
I know. But you know what? I actually have a bladder of steel of like, I can hold it. I'm like a camel now.
Wow.
So I did some sort of like bodily, I can hold it in all day now. I did like something overstretched unintentionally.
Yeah, it didn't quite bounce back.
Yeah, maybe not. Anyway, what about you though? I'm sure you have your own.
Oh my gosh, there's so many. Well, I used to have a lot more, and now I feel like there are few, which is nice. But hearing the sound of a baby's heartbeat on a monitor still gives me a panicky feeling. And so if I was ever in an exam room, or like the MFM's office, and I heard in the next room over someone hearing their baby's heartbeat, I couldn't. I wanted to run. The smell of an alcohol swab now, it's like a physical response of terror. And then it used to be just seeing a pregnant woman or seeing a baby girl. It felt like it would knock the breath out of me. And then, like going through a subsequent alloimmunized pregnancy often means you're exposing yourself on a regular basis to these triggers. There's just no way to avoid it, right? So that's hard. Yeah.
And also, I should say, we're kind of throwing around some labels here And not every mom will experience like clinically diagnosable PTSD or anxiety disorder or depression. And so we're not here to assign specific labels to a certain experience. But I think a lot of listeners will struggle with some of these same difficulties and stressors at different times during their pregnancy. So I think whatever your experience is, hopefully we can encourage you today to give some hope, some helpful coping strategies to get through those experiences.
I learned so much preparing for this episode, but there are three kind of broad categories of different coping skills that you can use in these situations. And in your, like when you respond to stress, these are the three different ways to cope. There's problem-focused coping, which is like you said, being prepared, taking actions to address like a source of stress and try to fix the problem, whatever that problem is. And then the second one is active emotional coping. So you're using strategies to regulate your own emotions internally, kind of. So you're engaging in emotional experiences like seeking emotional support or mentally reframing experiences. And then the last one is avoidant emotional coping. And that involves methods to try to avoid or suppress your emotions like self-distraction or denial. And I definitely slip into that sometimes.
And it seems like most experts seem to agree that the problem-focused strategies and the active emotional strategies tend to have better outcomes, whereas the avoidant emotional coping might provide short-term relief from a stressor, but long-term use, it says, is associated with worse mental health. And I will say sometimes if I am just overwhelmed with debilitating anxiety, sometimes I need to like almost carve out a time of like, I'm going to spend 30 minutes, in my garden. I'm going to spend 30 minutes sewing because I have to remove and I need to do something else. And that is, in my mind, like a baby bit of avoidant. But I think sometimes those coping things in the moment sometimes are what get you through a short period of time.
Yeah, for sure.
But I think this is, But I think talking long term about just like stuffing it down over and over and over, not good.
Yeah. That can really culminate into a bit of a disaster. But but I do think you're right, especially during your pregnancy. If you have to distract or, whatever you need to do to get through the stress, I think that's okay. And different people use different strategies, and you can combine certain strategies, and different things work for different people.
Let me share a coping strategy that's helped me, which is actually something my high-risk OB, or no, not high-risk OB, but it was the OB at the high-risk clinic. She told me when I was like back in the clinic for the 5th time for bleeding, and I was just crying, and I'm like, when will I ever feel better? When will I ever trust? And she was like, you have to just choose the next milestone and just get to there. Like, let's get to next week. Let's get to 26 weeks. Let's get to 28 weeks. And that really helped me reframe. And even outside of pregnancies, if I'm having those like extremely overwhelming days, I have to create much shorter term timelines. Like, I'm going to get to bedtime tonight. Like, I'm going to get to dinner time tonight. Those sorts of things. So I think like creating a schedule really helps almost. And of course, all of us have busy days. Like, it's not like we're all just lying around on the couch and we don't have a schedule. But sometimes I need to say, this morning I'm going to work with the kids at this time. I'm going to come back. I'm going to spend 20 minutes in my garden. Like, I have to create mini structures for myself as a way to like define my day. And it gives me a sense of peace and a little bit of control, especially doing things with my hands. Like, anything I can do where it's like my brain's main job right now is to sew this thing, is to clean this thing, is to fix this thing. That really helps, because it's like, this is what I can invest my energy in right now.
It is easier, I think, during your pregnancy to break it into those smaller milestones, because there's so much. It can be very easy to feel overwhelmed or hopeless. Like, we'll never get there. I'll never get to delivery with a living baby. It just feels like too much to absorb all in one go. And so if you just think, I'm going to make it until my next MCA scan next week. That's my goal, you know, or make it through this day, make it through this one infusion or this one next ultrasound. Then you can feel a little boost of like accomplishment, and then you can set the next milestone. And that seems to work really well for a lot of women.
Yeah, I totally agree.
Yeah.
I think that really helps me too, just to know like this will be behind me at a certain point.
Yeah.
And if you create a more narrow milestone, then it's behind you faster.
Yeah, that's true. Exactly.
It's like this. Yeah. And then also like community and connection to people who encourage you and understand what you're going through. And I think that's the beauty of our patient support group. I mean, that's what women say over and over that they find there that they can't find anywhere else. And then that's also why we're very intentional in the group about helping to prepare, you know, helping moms prepare, set up the best care plan possible. And that's sort of that problem focused coping strategy of trying to head off the stressors to the extent that you can in advance. And it was we were talking about planning this episode with Rose, and I know she said this actually, some version of this during our interview with her too. So I think it's in her episode somewhere where she was saying that the feeling of finally getting to Dr. Moise's clinic and finally feeling like she had laid all of that extensive groundwork and done the work and landed herself somewhere safe. And then she said that feeling was like, what did she say? Like taking a heavy backpack off and laying it down on the ground.
Yeah.
Like that relief of knowing like you did your work. You did what you could control.
Yes. I love that analogy that she uses. That's so good. Yeah.
What about you?
I agree with that. I think that was, for me, the number one thing that helped me cope with these pregnancies was making sure that the problem, which was, you know, getting the right care, having the right team of doctors, getting what I need and what my baby needs during pregnancy, doing what I could to solve that problem first. And then once I had done everything that I could to solve it, then I worked on the internal things. But that was the most important for me, was getting a new team of doctors, setting up the right treatments ahead of time, having a preconception appointment before getting pregnant again, and which I know not everyone can do that, but as soon as possible, setting up a treatment plan that you feel good about and your doctor agrees to, and then just making those preparations ahead of time. Because for me, if I'd stayed at that hospital where Lucy died, no amount of any of these coping strategies would have helped if we had received this, because they had said that they're basically going to provide the same treatment again with my pregnancy after that. No amount of coping strategies would have helped compared to just getting the right care.
Yeah. It actually reminds me of like, I'm going to butcher this because I wasn't prepared to say this.
It's okay.
But my husband and I talk about, my husband like nerds out on podcasts all the time on his way to and from work.
Love
and
it.
He talks, so he always tries to like pass along what he's learning on like mindfulness and things like that. And he was talking to me about the difference between having an internal locus of control versus an external locus of control.
Yes.
Of like, ideally you want an internal locus of control where you realize I can set up my environment. I mean, within reason, of course, but knowing that there's something you can do and believing that instead of just like hoping and anticipating that somebody does something else for you or a certain thing will or won't happen. And of course, so much is just what is sort of destined to be. But to the extent that you can assume, oh, I'm going to take on everything in my power, that's an empowering thing. And that sets you up, hopefully, for comfort.
Yes. And then I love that. That's exactly what I was trying to say. And you said it beautifully. You didn't butcher anything. I don't know what Connor would think. He might be like, that's not what I was saying, but it sounds really good. It's very applicable. But I totally agree that like what is in your control, do it to set up the right care. And then there's so much that is not in our control. And that's the stuff that you can have peace about after you've done what you can to make sure you get the right care. And I remember feeling that same way after Lucy died. I was pregnant again with my daughter, Nora. And I tried to try to go back to the same hospital. And they were just like, your baby's not going to survive if they are Kel antigen positive, which she was. And so finally at I think 18 weeks, I drove all the way to Houston, Texas. It was an 11-hour drive, lots of inconvenience, and it was expensive. And I had to quit my part-time job, and I had to bring my 4-year-old with me and split up our family for months. Anyway, all of that. So that was difficult. But when I walked into Dr. Moise's fetal center, I felt just like Rose was describing, it almost felt like a physical weight lifted off of me. And I felt like I could breathe again, and all of those symptoms were gone because I knew that he was going to take care of for me, the most important part, which was receiving the care that my baby needed to survive. And it was so, the magnitude of that relief didn't compare at all to how minuscule all of that inconvenience felt. The driving, the money, the quitting, none of that mattered compared to getting the right care.
One that I know, I think this came from you at some point, is to say to yourself that right now, my baby is safe. When you know that your baby is safe, like if you just had a scan that day, everything was looking good, you're on the right path, just being like, in this moment, my baby is safe. Just small things that are true.
Yeah. Or the one that we've kind of repeated to ourselves when we were feeling really, really low, which is, I'm safe. I'm loved. I'm doing a good job. I repeat that to myself often.
Me too.
Or for me, Bible verses were very important. So on my medical journal, I had the ones that made me feel really courageous and safe written out on my medical journal. So everywhere I took it, those verses were there to remind me of that courage and safety that I had. Some people listen to music during an IUT. A lot of patients can just listen to empowering songs or songs that give them peace, things like that, kind of just infiltrating your brain and kind of stopping the flow of the negative thoughts that are usually not even true. Okay. Another one is medications. And this is not right for everyone, but a lot of times medication can help during your pregnancy if you're really struggling with anxiety. There are some safe medications you can talk to your doctor about trying. And that was helpful for me. And I think you too, Molly, right?
I think I did during one or two of my pregnancies. I had Zoloft. Yeah.
Yeah. Okay. And then another one is therapy. Yes. I know we say this a lot, it's no big deal. It is kind of hard to find a good therapist, get in, get hopefully insurance approval, but it is so worth it once you get in and, just have that person as your, guide through all of this. And, it's so great I never went to therapy during my pregnancies. And in hindsight, that was a mistake for me. I just thought, well, they're going to survive. They're surviving. So that's all that matters. I don't need therapy. But it turns out then at the end, it was tons of trauma, even from the pregnancies where they survived.
Yeah. I think that I feel like a lot of moms we talk to, sometimes all of that emotion doesn't hit until they're out of the responsibility of managing their kid's disease.
Right.
And then it's their baby is 6 months old or 1 year old. And suddenly they're like, wait a minute, I haven't really processed what I was suppressing at the time just to keep getting through. I feel like we hear that a lot.
Right. So I just imagine that, of course, if you have time, it's so hard to find time for anything during an allo pregnancy, but I think it would have been very useful to just have someone walking me through these coping mechanisms and how to handle different situations as they're happening. And we saw this great clip from the Mass General Hospital Center for Women's Mental Health. And they said that for women with PTSD, they recommend, there's different treatments available, such as psychotherapy and antidepressant medication like SSRIs, and therapy targeted at PTSD symptoms during pregnancy should really focus on establishing a sense of safety and coping with active symptoms. So getting through that situation, that pregnancy, and exploration of traumatic events should only be done when a woman is not in crisis. Given the potential for worsening of symptoms, engaging in exploratory therapy like EMDR would not be recommended during pregnancy or the postpartum period. And of course, women should discuss the risks and benefits of treatments with their doctors. But I thought that was such a great point, where you don't need to be going deep and doing any type of therapy that is bringing up trauma during when you're in the trauma, just focus on, getting through and like dealing with symptoms. So I thought that was important to include. It's also helpful to focus on, try to find something good. Try to find something that you're thankful for. Gratitude is so important. And I remember during my pregnancies, I would try to find one good thing about whatever it was I had to face that day. So going into an IUT, I would look for one enjoyable thing. And I always found it, even in the most stressful situations. Going in to have a port and permacath surgically placed, and I was scared and it was going to be painful. And I found something actually enjoyable during that day. And that really helped me. So just noticing something good that's around,
Like, this is what I thought of, which is like something that I'd be grateful for even in those situations, is the opportunity to lay down.
Yes, that was
laying down.
Yeah, like, that was one of them.
I am still. No one's pulling at me. Like, no one needs me. Like, that's how I feel. If I'm going to have dental work, I'm like, I'm good because I am horizontal right now. Like, this is great.
Exactly.
Terrible.
That was literally the thing that I started enjoying about IUTs. Right. And not only that, they give me a little hit of those good drugs.
Just a quick bump. That's right.
Yeah, to get like the really good nap. And nobody needs me. I'm getting drugs that make me sleep even better. And that was fantastic. So, yeah. And that kind of leads to the next one, which is reframing. This is so important. And looking back, I realized that I used this often, which is one of those, I think, emotional, internal strategies. And basically, you're looking at a situation and then trying to reframe it in a positive light, which is not always possible. But there was this great quote. There's this just a great quote that you said in our episode about grief and trauma, which our listeners can just go back and listen to the exact quote there. It's from my blog. But you said it was like the essence of motherhood for you. And it's basically me reframing the whole alloimmunized pregnancy situation and what happened to my kids, to say that I will honor my children's stories because it's their story. And I don't want some other lady's pregnancy, no matter how easy it was for her. I don't want her pregnancy because that's her baby. I'm going to appreciate my baby's journey, whatever it is, because it is my child's journey. And seeing it like that really helped me reframe the whole thing, the whole ordeal. So that's just one example of how you can reframe. Much. Yeah.
I loved that. And I think, that's helpful for me to hear today, like every day. Right. That's helpful to hear.
Yeah. And some, like Katie, I know a lot of people hate this thought, but Katie always says, like, she and her husband, Alec, would say it could always be worse, which some people are like, don't ever say that with your trauma, but for some people, reframing it in that way is actually beneficial. It is actually helpful. So, and I remember thinking that and feeling encouraged by it somehow. I guess it's kind of like when Katie and I visited Kenya, and we just saw like the lengths that these women had to go through just to get even like phototherapy lights, you know, after their baby's born or something. They just didn't have access to the basic necessities. And we didn't feel better. We actually felt horrible seeing this and realizing what care looks like in some of these other countries. But it helped reframe our experiences here in the US of like, wow, we had access to such phenomenal care. We had access to all of these treatments during pregnancy, after delivery, and just a deep gratitude for the things that we did have during our pregnancies. Okay, so that's reframing. And then breathing exercises. There's so many breathing exercises you can do. And that just really helps in the moment to center you and help you process kind of what your body is going through and bring you back to the moment. Okay, and then the next coping strategy is grounding techniques. And I realized when I was researching for this episode that so many of my personal coping methods during my pregnancies were actually grounding techniques. So that was interesting. And I think even when you were talking about, Molly, like going out in the garden or doing something with your hands, that is an example of a grounding technique where it helps you be present in the moment. You're not back there where that terrible thing happened. You're here, you're sewing, your hands are in the dirt, you're gardening, you're feeling the sun on your face, you're walking barefoot on the grass or whatever. And so these techniques can help pull you away from the flashbacks and away from those unwanted memories and into the present. And so here are some just quick examples of ways that you can do these grounding exercises in a moment of stress or like terror or whatever you're experiencing. Okay, so you can run cold water over your hands. You can say those affirmations, something to yourself over and over again, like, I am safe, or my baby is safe. And you can look around the room and find something that you can see, something you can touch, something you can hear, something you can smell, and something you can taste. And then things like praying or this was so cool. I saw this one online. It said, listening to a voice recording of someone who makes you feel safe. And
that's cool.
Yeah, that's such a great idea because you're using your senses to then alleviate these like past memories or experiences, and you're bringing it here and now. And another thing is to listen to music, like we said, or like imagine yourself in a safe place that you love. And I wanted to say just some of mine really quick that helped me during my pregnancies. So I would write like a very meaningful Bible verse on a note card and I'd fold it and then keep it in my pocket. And so sometimes I would just, when I was scared, I'd just put my hand in my pocket and feel the note card. And that alone would like ground me and make me feel okay, And I also did this with a printed off copy of a study that Dr. Moise did showing the efficacy of plasmapheresis and IVIG for women with severe and early onset alloimmunization and HDFN. And that is like, I think that has to be the nerdiest grounding technique of all time.
I love that.
So it was like just having it in my pocket would give me hope and make me feel grounded. And a lot of those I used during pregnancy. Right.
Yeah.
Hold on. Oh my gosh. Okay, I was going to show you. Okay, so I learned this in my therapy sessions, but one of the grounding techniques was to imagine like the safest place that you could think of where you feel totally comfortable and like just surrounded by security. And so I immediately thought of this book that I read when I was a child over and over again. And the last page has the bunny, the main character, like in his hollow tree. And it's warm and it's cozy. And then outside, I think it's like a winter storm is raging or something. It's cold outside, but it's like warm and safe in his little hollowed out tree. And so that's what I still do. If I'm feeling really panicky, I imagine that I'm in that space. And I have the book right here. Okay,
Aww.
I'm a Bunny. It's one of my favorite kids' books. Okay, and then here is, I don't know, can you see it? Wait.
Oh my gosh. Yeah.
Can you see him? He's in his...
Yeah. I love that.
So I guess just as a child, that had brought me great comfort. And so that's immediately what I reverted back to. And I use it all the time, is just being in that hollow tree, warm and safe. So you can try to think of somewhere or someone that you're with that makes you feel secure, and just imagine yourself there.
Mm-hmm. I love that so much. That's how my dad is that person for me sometimes, even, I mean, even now I call him and he knows if I'm feeling overwhelmed, he automatically knows he should just talk, like just about anything.
Wow.
He just he'll talk for as long as I need. I'm crying.
Oh,
he's actually
so sweet.
I know.
Oh my gosh. That is so sweet.
He's the sweetest. Yeah.
Oh, your dad. I love when your dad shows up at like our webinars if you're speaking.
He does. In his like hunting gear. He'll be like in hunting gear in his basement. Like no one's video is on and then he's there. And I'm like, this
so
is
great.
a trauma grand rounds, Dad. Like, let's turn off our video.
Oh my gosh.
Anyway,
and he's
awesome.
so into like what you're saying, whatever you're saying. He
takes
into
notes
it.
and then calls me to give me feedback after, because he's like, she might want some like constructive thoughts or whatever. It's
that's
cute.
so cute.
I know.
I love it.
Yeah.
Oh my gosh.
Oh man. Oh, so sweet. Yeah, there are some people. I feel like people have, I don't know, do you have a few people in your life that you just, when you're near them, you just emotionally release a little bit?
Yeah.
And that's my dad, my husband, and my older brother are those people for me. Like,
that's
I'm just
amazing.
like, anyway.
Well, I feel that
okay.
I feel that way around you and Katie, honestly.
Yeah,
you
that's
guys
true
came
too.
to mind. I was like, they are like, I feel like my safe people, and
I know
you get it, and I can just be completely myself. And unfortunately, Dr. Trevette, I've cried so many times in front of that man. And
I totally get that.
But it's like, I feel that release of like, I'm safe now, whatever the problem is.
Yeah. Yeah. I want us to play. It's just like a 2-minute audio excerpt from a mom. All of us are always talking to individual moms through their pregnancies. And me and another woman who's on our patient advisory board, Emily, we're working through and talking to this mom, Christina, while she was going through her pregnancy. And it was a low titer pregnancy. But afterwards, she was just trying to advocate for her baby, and it was exhausting. And her daughter was like right there on the brink of, do we need to transfuse afterwards?
Yeah.
And still she was really having to be on top of that.
Yeah, I
and
remember.
so she shared about the way it's affected her life now afterwards.
Thank you so much for coming through with that message. Firstly, for the encouragement. Emotionally, this is totally taxing. And I think I even suggested that, an episode in the podcast, maybe there is one already, to be dedicated to this aspect, the emotional toil and trauma. Like, I definitely know I have medical trauma from this, just the constant vigilance. It has left me hyper vigilant, in every area of my family's life. I'm constantly thinking, did my 19-year-old get home? Has he been in a car accident? Matt says he has a pain in his back. Okay, oh my gosh, well, it's probably cancer. Like, it's just made me into this ridiculously hyper vigilant person. I think probably because I'm, in this habit of trying to be watchful and not miss anything, which is what you have to do. Which with alloimmunization, you have to be monitoring. And so that's like a good thing in this disease throughout pregnancy, but it's not necessarily a good thing in real life after this disease, because you're left with this sort of like, what's going to go wrong next question. And it's really totally draining, as you both know, I'm sure.
She just explained it so well. That's exactly how it feels. That hypervigilance and like always being watchful. You do have to do that during your allo pregnancy, unfortunately, most of the time. And it's exhausting. And then how can you suddenly, you have a baby and here they are, and then suddenly turn it off and not be that way with them? It's very, very difficult. And, again, here you are, you've given birth, you're flooded with hormones, and you're dealing with that monitoring and care for HDFN post-birth if your baby needs it, and all of that. And then you are left with, wow, what just happened? What did I just go through? And so sometimes those feelings or symptoms of PTSD can kind of pop up after pregnancy, after delivery, like you said, Molly, even like 6 months later or a year later. And so really quickly, I wanted to list just some of the PTSD symptoms that postpartum moms might experience. So loss of interest, hypervigilance, irritability, difficulty sleeping because you keep like replaying things or analyzing or worrying about things, emotional reactivity, that's the lava monster, avoiding reminders, nightmares, and just avoiding thoughts or feelings completely. An exaggerated startle response, feelings of detachment. I remember feeling that with my surviving HDFN babies. Sometimes it would like really catch me off guard. Like, I love them so much. I got them here. They're miracles, and I feel detached emotionally. Yeah. So also intrusive thoughts, really struggled with that. So, this was, a big one I read on this list. I was like, oh my gosh, that's what that's from. A sense of foreshortened future. Have you ever heard? I've never heard of it said like that. Where
foreshortened. Yeah.
Yeah. So I really struggled with that. I still do. But like, say my mom was making plans for next year's family vacation, I would think how the audacity that you would just think we're all going to be alive. You think we're all going to be alive next year?
Yeah.
Like,
wow. Yeah.
How can you possibly plan that far in the future and just think that everything's going to be fine? Like, you don't even know who's going to be here next year.
Right.
And I was baffled by everyone's like assumption that everyone will still be here in 3 months or 6 months or whatever. Yeah.
Yeah. That totally makes sense.
Yeah. So I do think in that like 4th trimester, it's super important to try everything possible to get rest, to get sleep, which is like, what is the word? It's just ironic to even say that with a newborn. Make sure you get sleep.
I know.
But I do think it's important to do what you can to try to get sleep and exercise, of course, and getting outside is so important. Doing those grounding techniques when you need them, or the breathing exercises that we mentioned earlier. And of course, finding a good therapist if you don't have one. And this is the time to kind of start thinking about maybe using therapies like EMDR, which is eye movement desensitization reprocessing therapy. And I have benefited so greatly from EMDR therapy. It changed my life completely. So it's basically a psychotherapy treatment that has been extensively researched and proven effective. And it helps people with PTSD symptoms like flashbacks or really upsetting thoughts or images, and that hypervigilance that we talked about and other symptoms. And so basically your therapist will do it with you. And it's this, it uses eye movements or sometimes audio tones or even like a small handheld buzzer. That's what I used to repeatedly stimulate the left and right hemispheres of your brain, and then talk through these memories that are very traumatic. And it helps, this sounds crazy, but it helps to store these like debilitating memories, restore them in your brain into just the simple memory category, where it's just something that happened. You don't think about it. It's just stored back there. And it can be really helpful. And then the other main type of therapy is called CBT, cognitive behavioral therapy. And that's just helping you to adjust and realign your negative thoughts and feelings and behaviors that are stopping you from having a good quality of life. And they kind of break down the big issues that affect your day, and then they create small achievable changes, including coping strategies or new ways of thinking and acting. So it really just helps you step by step know what to do.
Yeah. That's so helpful to have that explanation, because I think if people don't have past experience with those options, they need to hear that's what it's intended to do, and that's what it entails. I think one of my big ones that I wanted to add also is when I am just like really consumed and in my own head with what I'm going through, I just feel like a swirl of emotions. I feel like very closed in within myself. And so like one of my big coping strategies, which I think is partly why you and I have the jobs that we have, is in pouring myself into other people. And I don't mean like totally neglecting myself and not taking care of myself ever, but I mean, I feel very connected and peaceful and humbled when I realize my place in the world with everybody else. And just finding a way, and it doesn't have to be big. I mean, it can be volunteer, and it can be, we talk about having blood drives. Like, that's wonderful. We're wearing our blood drive shirt right now. But simple things like checking in with a friend, remembering when a friend has their doctor's appointment for their thing, envisioning what they're experiencing right now, whether it's something hard or something joyful, and just placing yourself in the lives of others helps me so much to realize like I'm a little piece of this really big thing, and I feel so much more grounded and fulfilled when I am, expanding myself into my community and my family and my friends. And so there's like tiny ways to do that. Like we were saying, remember when a different friend has a doctor's appointment, even though you have doctor's appointments too, check in with them. And, volunteering. We love Ronald McDonald House, obviously. You did that. You were there. Bethany Rose was there. We know tons of moms who benefited from there. So like doing something more concerted, but it can be small. I mean, donate blood, donate plasma, get in the support group. That's a perfect opportunity. Yes. Do it in your own life too. It doesn't have to be, assigned or tied to this disease, but having people join in the support group and support each other, check in on each other, it's huge. Like we love to see it so much, and it's really mutually rewarding,
Yeah, totally agree. And even just sharing your experience, if you feel up to it, can like change another person's life who's going through the same thing. It can be incredibly, just have a great impact. And for me, as you're talking, I was thinking this is what led to me like really shifting from lava monster trauma to the growing and the flourishing, and like seeing green things take root and grow. And the beauty of that is the outcome when I channel my loss and trauma into helping others. And it has changed my life. Yeah. Good one.
I think that's a perfect one to end on. I know. Yeah. Okay, let's transition into something kind of fun. So earlier we talked about preparedness as a way to find a sense of safety and control. And so one of our kind of patient prompts this season was to ask, what's in the bag? Like a little fun game show question. Like, what did you pack in different bags? Your delivery bag, your IUT bag. So, we asked online, what did you pack in your delivery bag, like, specifically for this disease? I mean, you can Google and find, you'll have tons of friends and things online about what else to pack in your delivery bag. But a lot of moms said, of course, the newborn booklet that we have for free on our website, the provider primer, same thing, free on our website, chapstick. What's the chapstick thing? Is it just because your lips get really dry because you can't eat and drink and you're in there for forever?
I don't know. I was thinking that's such a common one that we see. I mean, yeah, I think that's part of it. I don't know.
Yeah, probably.
I don't know where my chapstick was.
I know. I was not aware of my chapstick placement, but I guess it depends on the person. I was like, where's my chapstick while I'm pushing a baby? But anyway.
Oh my gosh. Yeah.
Oh my gosh. No, I could totally see. I mean, if you're not allowed to eat and drink sometimes and you're there for a long time, it's like, I need something here. Anyway.
Yeah, I just imagine like me and you like holding our newborn with these like dry, cracked, and flaking lips. I didn't need chapstick, and it's just like this horrific
chapstick, and we're just like these crusty old ladies. Yeah. Awesome.
Yes.
Oh my gosh.
Oh my
and
gosh.
Then paper copies of the newborn blood tests that are needed to just like give to your delivery team. What's this say? Oh, a TENS unit. You know what that is, right? I feel like you know that more than me. TENS unit.
I've just been waiting.
What is that?
I was waiting for you to finish the list so I could ask you what a TENS unit is. I mean, I know what it is for like
stimulation device for.
Oh,
like
I thought it was
therapy?
Like. I think of it as a math manipulative when you're teaching preschool or kindergarten math. A TENS unit.
I know exactly what you're talking about, but I don't think that's it. But I know exactly what you're describing.
What was
like
she
number
counting?
blocks?
Yeah, like number blocks, like counting every contraction and putting them in groups of 10. I don't know.
I think it's like a nerve stimulation, like physical therapy type of thing. Yeah, sort of like your heating pad, how that's your like emotional support object.
Yeah.
I bet that's what it is. Yeah, which is on the list too, of course.
Wow.
Obviously.
Okay.
Snacks are great.
Yeah.
I live for snacks. Gotta have some snacks if you're allowed to have them.
Very
and if
important.
not, then you can just long for them until you can, and then you just eat them all.
Yes.
And
that sounds so
some
good.
people wrote, this is cute. I love this list. The next 3 things are battery candles, twinkle lights, and friends.
Oh, it's so good. I love it.
Oh, CJ, our producer, just pasted in TENS. Transcutaneous electrical nerve stimulation. Okay, so I think it's like a low vibrating, like kind of just like a therapy device, I think.
I did use that in my physical therapy when I was trying to get my muscles to work again after knee surgery. You're right. But I had no idea. Yeah. Wow. Okay. So for labor.
I like that. That's cool. Battery candles, that's nice. Setting a good tone. Twinkle lights, like maybe those little battery powered ones.
Yeah.
Friends.
Wow.
That's so cute. I love it.
That's so nice. Oh, okay. So,
oh no, we're yawning. We got to wrap this up.
Sorry. I'm sorry. I was feeling really comfortable in that room with the candles, the twinkle lights.
I know.
And the
It's
friends.
like I'm
so
snuggling
settling
with my
in.
friends and my lights.
Yeah.
Yeah.
Okay. So I thought it was interesting seeing this list that it feels very different. It's like a shift away from the typical list that most women would have for their bag or diaper bag leading up to delivery. And what I'm seeing here is like these moms are mostly focused on having what they need to advocate for the right care during and after birth. And I just feel so inspired just seeing that. Like they're like, I'm going to be prepared. I have what I need to advocate for my baby. And that's just amazing. I'm always inspired by allo moms. We asked, what did you pack for your IUT bag? Okay, here's the list. Slippers or slides, headphones. Lots of people said headphones. Comfy clothes, good pillow, fuzzy blanket, the Molly bear, A good first meal to eat after fasting forever. Snacks. So these are just the actual responses we were getting. So snacks. I was always starving since I couldn't eat before. And then somebody else said food for after, 3 exclamation points.
Yes.
And several people said a book to read. So I love that they are really thinking about snacks. I remember.
That's important. It's a comfort item.
Yes. Well, remember one of those internal triggers can be hunger, right?
Yeah. Yeah, definitely. And I can already see, but I feel like we've talked about Molly Bears before. But anyway, just to briefly, for anybody who doesn't know, those are such an incredible product. It feels weird calling it a product. Like that makes it sound even less valuable than it is. But it's, oh, Emily, that's right. Emily Rush talked about having one in her episode, but it is for families who have lost a child. The Molly Bear has the exact same, is it the same weight as the child?
Yeah. The birth weight of the baby. Yeah. And they personalize it.
Yeah. Oh,
it's
our
really
friend
special.
Kate has one.
Yeah. Well, I had actually, this is sweet. So Kate had heard in last season's episodes that I had said, I've always wanted a Molly Bear. I don't know why I don't have one yet.
I
She
can't believe
she made one for me herself from scratch. And it weighed exactly 1 pound. It's a little bunny. It's so beautiful. And it says Lucy Dare. And I love it so much. So she made that. That's our community. That's why it's just, I love being in this community with these women who really get it.
And that's
thank
what
you,
we're
Kate.
talking
I
about.
love it.
Yes. And Kate has endured her own incredible grief. And while she's grieving, she made you a Molly Bear. That's exactly what we're talking about. It's
crazy. Yeah.
Yeah.
And that brought her a lot of comfort in doing that. Okay, so yes, the IUTs make you hungry. I've never been that hungry in my life before, is like coming out of that IUT and I haven't eaten since the day before. And it's like the first thing I would say when I got to recovery was, when can I eat?
Yeah. Heck yeah.
Okay, so I'm going to quickly run through our list for what do you pack in your bag? What's in the bag for plasmapheresis and IUT? Oh my gosh. Plasmapheresis and IVIG treatments. And so I noticed that a lot of the moms are saying the same thing over and over again. And then I realized that there are some pretty clear themes. So I actually grouped all of these into kind of the natural categories that they seem to land in. Okay. So when you're heading in for plasmapheresis or IVIG, women have packed sustenance. That's a more respectful way to say good old snacks. Got those snacks. Sustenance. Okay, so
fancy
they said
word for snacks.
Electrolytes, water, snacks, protein-rich snacks especially. And then the next category is comfort or peace items. So that includes heating pad. Lots of people said heating pad. I always brought my heating pad with me to those infusions. Comfy clothes, a sleeping mask, loose clothes, nursing bra to unhook for easy connection to the permacath. That makes sense. Okay, another category is medications. So somebody mentioned lidocaine cream for port access. That was so important for me too. I took that everywhere. That it's a numbing topical cream to help that needle go in easier to your port. And then Zofran, which is for a medication for nausea, and Furosec, which is for those terrible headaches that you can get from IVIG. And the next category is entertainment, because you are sitting there for hours usually for these infusions.
Yes.
So people packed books, the Kindle, computer, charger, and headphones. And then the last category was advocacy. A lot of people said they packed either the prenatal booklet that we have or a copy of their baby's medical history and notebook to write down treatment notes, and then I always brought my medical journal to every appointment. So that's the list for plasmapheresis and IVIG.
Okay. Wow, that's so helpful. I think a lot of moms ask for and are like looking for those concrete recommendations.
Yeah.
Okay, the next one is NICU. So what do moms usually pack in their bag for the NICU? Understanding though, I feel like it's also important not to put a bunch of pressure on yourself to like have every single item there immediately. Like there's always, if there's really something important, hopefully someone can grab it for you, or there's something accessible at the hospital you can get. Like, I feel like adding pressure of like, it has to be perfectly packed. So I am like, don't have options to get it elsewhere. It's okay if you forget something. Right. But anyway.
But let me quickly on that note, sorry. Well, Callum, my son Callum, was born as I was being prepped for an IUT, and his heart rate plummeted, and they had to do an emergency C-section. I was all alone, and I was not prepared. I did not have a bag for him. I did not have any of these things packed. And I survived. He survived. It was fine.
Exactly. Yeah. Here we are.
I just got the items later. I mean, he's stuck there in the NICU,
Yeah. But it is fun to plan and try to, like we said, like put your arms around what you can control and anticipate. So I think a connection item to your baby, like bonding. What's this bonding octopus and bonding hearts, which is like fabric. Yeah. Go ahead. You explain.
Kate had this cute little, it looked like a crocheted octopus stuffy. I'm guessing she made it, but she kept it with her, I think. And then I went and visited her and her baby Noah in the hospital. So sweet. But she had the octopus with her. And then when he was taken to the NICU, it went with him and it had her scent on it, and that's the same purpose for the bonding hearts. Do you remember Rose had that when Lucas
Rose
was in the NICU? Yeah, she would actually just put them in her bra.
Fabric hearts. Yeah.
Yeah.
It doesn't have to be, it can be just like a scrap piece of fabric or whatever you cut into a little shape, put it under your shirt, lay it next to baby when you go, if you do go home for the night or you're, taking a break to go get something to eat or whatever. And stuff to make the incubator cozy. Of course, without like covering baby too much if they're getting phototherapy and all of those things. Like a stuffed animal, a blanket, pictures. Oh, Ollie swaddles. Those people love those. They like wrap them up. They look like little mermaids.
I don't know what. Is it like the Velcro? It like Velcros.
Yeah,
baby?
Kind of. It just like wraps them. Yeah, they're all wrapped up just from like neck or
that's nice.
Chest down kind of thing. Feeding things like a portable pump to save time if you're going to or from the NICU, or a wearable pump, a friend to wash the pump parts. Heck yes, if at all possible.
That'd be nice.
If a different person can have the responsibility for washing and setting up the pump parts.
Yes.
Whew, that's a full-time job. Bless that person. But yeah, if you're lucky enough to have a partner, a spouse, or a friend with you in that room, give them that job. Heck yes.
Absolutely.
Advocacy items, written copy of the baby's medical history, a journal, the newborn booklet, printed copy of the provider primer that we have online. So much more credible kind of than like, here's this thing on my phone with the support group says, like it's nice to have it in paper. And then stuff to eat, like really sustaining things like bone broth, something really filling, truly.
Yes.
Yeah.
Oh my gosh.
Because sometimes you can't always have tons of food and snacks. Although I turned Rose's NICU room into like a small grocery store. So
oh my gosh,
snacks. I have a snack problem.
Yeah. I did too, but I would always bring her like hot tea and stuff in there. Yeah.
That's great too. That is great. Yeah. And then entertainment things, a book, a journal,
Yeah. I love all of these. And it really does feel like you're sitting there for endless hours in the NICU next to your baby, just sitting there. I remember we were not supposed to have food in the NICU when Callum was in there. He was in for 3 weeks. And so I would get so hungry. And honestly, I would just get bored. I'm just sitting there. And so I became fixated on these individually wrapped wintergreen lifesavers.
Those are so good.
Oh my gosh. I would stuff my pockets with those, sneak them into the NICU, and then I would just like munch one after the next on the mints.
Those
That
are
got me
so
through.
good.
It really got me through.
Yeah, agree. Snacks are indeed very important.
Yes.
Yeah.
Yes.
Outside of wintergreen mints, which I understand their value, when Callum was in the NICU, was there anything else that was important that wasn't on that list from other moms?
Oh, yeah. Well, I agree with the personal connection. It was really important for me to kind of have like a personal item on Callum, like a hat or his own little passy or even just socks that were his from home felt really important to me for some reason. And I always thought like, I also wanted just the medical staff to just see that like, he's his own person. He's Callum and he's loved and cherished by this whole family that can't be with him. And so that was really important to me. Oh, and one more thing, just a little outfits that either button down the front or it's just a top and pants that aren't connected. And then you can, once they're done with phototherapy, put them in their own little outfit from home. And then the wires and tubes can come out where the buttons are or where the top and is separate from the bottoms. Yeah.
I love that. Good practical tips. I'm going to tuck those in there. That makes so much sense.
Okay, I think we did it. How do we say goodbye when we just had fun hanging out and talking about anxiety
I
together?
know. I hate to just be like, see ya. Let's just go part ways with our anxious body. Yeah. Let's go be anxious separately now.
Oh my gosh.
I don't want to just like end. I do want to say if anyone's listening and they're like, okay, now I'm done listening and like hearing these lovely soothing voices that I just love so much.
Oh yeah.
Which is what we provide. Yeah. We just have the best.
Yeah.
You can like, if you're looking for the next step, go to our support group. It's called Antibodies in Pregnancy, an AHF support group. It's on Facebook. Go there next. We're on there. You know, you'll find other moms. Read if you want. Just like take it in or post or support. Do anything to just be a part of that. It's a gift to them and to you.
And to us.
And us. Yeah, we appreciate it.
Sure. Come join us. Okay, so let's wrap it up here. Whether you are a patient, provider, or otherwise affected by antibodies in pregnancy, we are here for you. We have great resources on our website at allohopefoundation.org. That's allo spelled ALLO, hopefoundation.org.
Thanks for listening. All right, guys, I am